Well, much of the nation's attention this week is focused on how the Thanksgiving holiday will affect the number of COVID-19 infections and deaths. In Utah, the numbers were already off the charts on Thanksgiving itself. Fox 13's Max Roth joining us now in studio to put this all into perspective. Max.
Yeah, thank you, Amy. You know, the pace of new hospitalizations and deaths is startling when you look at it over time. And we look at 3 recent holidays, and they provide excellent markers for all of us to see how much faster COVID is moving through Utah.
On Labor Day, September 7th, Utah's intensive care doctors and nurses were treating 41 COVID patients. By Halloween, it was 130, and it was 211 on Thanksgiving in intensive care, a more than 5-fold increase in 2.5 months. Deaths kept pace. Labor Day's 2.4 average of deaths per day in Utah more than doubled by Halloween, and that more than doubled by Thanksgiving. This chart shows every COVID death in Utah, and each number marked shows when Utah saw another 100 deaths. It took 91 days for Utah's first 100 fatalities. It took 11 days to get from 700 to 800. Imagine the increased pace from another perspective. If those initial 91 days were an average walk, say a 20-minute mile, then the latest 11-day pace would be faster than Usain Bolt when he set the world record for the 100-meter dash.
And when we talk about that, it's the patients and the healthcare workers who are now running that 100-meter dash every day. A study published in a psychiatry journal this fall showed COVID's toll on doctors and nurses. Nurses in particular, 64% showed symptoms of acute stress disorder, 53% showed symptoms of depression, and 40% showed symptoms of anxiety disorders. Live in studio, Max Roth, Fox 13 News.